Hello, dear doctors. I hope that all of you are managing very, very well. You all know that our session today is about clearing the doubts about MLA exam. I know that many of you, almost all of you, are stressed, anxious, asking themselves, okay, what should I do? Do I need to change anything in my preparation? We are very, very anxious. What will happen? And all of these questions are running in your mind. And it's totally understandable. So I have arranged this meeting to reassure you and to explain to you what is happening exactly. All right? Okay. Before I start, I want to welcome everyone here. Thank you for attending. Thank you for joining us. Hopefully, you will find this session super helpful, inshallah. My name is Sahar Ali. I am the founder of PLAB 2 Warriors Groups. I work in the NHS in acute medicine. I am a simulation faculty for the junior doctors in my trust. I am also a PLAB 2 instructor for more than 4 years now, alhamdulillah. Through this period, I helped hundreds of doctors to pass their exam through the services that I do provide, which are the full course, the practical course, the one-to-one mocks. Recently, I resumed the free mocks in a renovated format, which is conduction of teaching sessions on a specific topic. These teaching sessions will be added to a new series of videos named Teaching Gems. After each teaching session, there will be a mock session on the topic discussed. This will help consolidating your knowledge and technique in that particular topic. Hopefully, you will find the sessions super helpful and beneficial. All right, what is our agenda for today? We are going to talk about PLAB versus MLA. What is MLA exactly? What changes will happen? Will this affect my preparation or plans? Will this cause any change for eligibility to the exam? So let's talk about that. You all know that there are many routes to start practicing in the UK. One of the main routes is what? PLAB path. The question is, did PLAB change into MLA? The answer is no. No. PLAB is still existing. What happens that PLAB exam will become compliant with MLA requirements. Okay, so what is MLA? All right, let's talk firstly about PLAB. PLAB is the short form of Professional and Linguistics Assessment Board. And this exam is for the international graduates, which are you. You are an international graduate, okay? So the PLAB exam is for you. It consists of what? Of part 1, which is PLAB 1, and part 2, which is PLAB 2. PLAB 1 is an MCQ exam for your knowledge, and PLAB 2 exam is an OSCE exam to test you on your ability on applying this knowledge in a simulated scenarios. All right? All right. What is MLA? MLA is the medical licensing assessment. This will be for the international graduates and the UK students as well. So the PLAB 1 is for the international graduates. The MLA is for both of them, the international graduates, you, and the UK students. All right? It consists of what? Consists of two parts. AKT, which is applied knowledge test, which is equivalent to PLAB 1. It's an MCQ exam, equivalent to PLAB 1. The other part, which is CPSA, Clinical and Professional Skills Assessment. This is an OSCE exam, which is equivalent to PLAB 2. So if we can say what is happening is just renaming or rebranding of themes, all right? This implementation or change of the names will happen on AKT in August 2024 and on PLAB 2 or CPSA on May 2024. Okay. Why is this happening? This is for the MLA providers to make sure that they are fair and consistent with who they will decide to practice safely in the UK. Either you as an international graduate or the UK students. So both of you, both of the international graduates and UK students will be assessed based on the MLA assessment. Okay? So we have talked about why. How will this happen? The international graduates, which are you, is being assessed by the GMC itself. And this will continue to happen. The UK students will be assessed in their universities, under the umbrella of the GMC in line with MLA requirements. So they will have their exam in their universities. The medical schools ensure that this exam is incorporated in their curriculum. All right? So they will have the exam in different place and in different time. All right? When they have their exam, they will have the degree of FY1. You, when you have the exam, you will have the degree of FY2. All right? All right. What changes will happen? To be honest, no significant changes. The international graduates will continue to take PLAB. The name of the exam will be PLAB for a while. If there is a change of the name, it will be later on, not for now. All right? The difference is the PLAB blueprint. What is PLAB blueprint? It's the document which consists of the curriculum for FY1. It will be replaced by MLA map content. All right? So the blueprint of PLAB, which consists of the curriculum of FY1, will be replaced with MLA map content. All right. What is MLA content map? It's a document or a map sets out what? Sets the core knowledge, the skills, the behaviors needed to practice in UK. Okay? If we have a dig or a zoom in the MLA content map and the blueprint, we will know more. Let's have a look. This is a screenshot from the PLAB blueprint. As you can see, mental health in multiple of cells. Musculoskeletal, in multiple of cells. It makes your eye a little bit uncomfortable, right? In the MLA content map, you will find, let's focus on the mental health and musculoskeletal. You find mental health in one cell, musculoskeletal in one cell, And when you click on the mental health or musculoskeletal or any link here, this will take you to a table with all of the conditions that are related to the mental health ordered by the alphabetical order, also in musculoskeletal and in all of these topics. All right? So it's a kind of more organization of things. There are some addition, some deletion, and some changing of names of some elements. What does that mean? All right. These are screenshots from a document. This document is the MLA Content Map, published in 1921. So the changes have been added already. Okay? They are not going to add or delete or change. The changes has been done. Okay? You will find some addition of some topics like acid-base abnormalities in acute medicine or acute and emergency medicine, anxiety, phobias, OCD, appendicitis to child health. Be aware that the MLA content map is for both part 1 and part 2. Part 1 and part 2. So these elements or these topics have been added either in PLAB 1 or PLAB 2. All right? I'm sure that acid-base abnormality are in PLAB 1. If you have it in PLAB 2, you might find it in the SIMMAN. They might give you a kind of VBG or ABG to the patient just to read the electrolytes and the ABG of the patient to find if the patient is acidotic or alkalotic, and that's it. All right. So the content which is added to PLAB 1 and PLAB 2 as well. Okay. All right. Anxiety, phobias, OCDs, appendicitis, biliary atresia, diabetes, essential and secondary hypertension to obstetric and gynecology, transfusion reactions, purpura, idiopathic arthritis in children, Kawasaki disease. So these topics have been added to either PLAB 1 or PLAB 2. All right? So no changes are going to happen. It happened already. It happened already, either in PLAB 1 or PLAB 2. Deleting. There are some deletion of some topics. Some topics. Why is that deletion? It's just to avoid duplication of topics. There is no topic called anuria anymore. It's covered under oliguria. No topic called chronic pain, patient needing pain control, perioperative pain, because it's covered already on as one topic, which is acute and chronic pain management. And so on. In changing, there are some terms that changed or has been changed. What are they? There is nothing called acute renal failure. What is used now is acute kidney injury. There is no term called chronic renal failure anymore. What is used now is chronic kidney disease. All right? So some addition, some deletion, some changes that already happened to both PLAB 1 and PLAB 2. Okay? So these topics either in PLAB 1 or PLAB 2. Got me? All right. Okay. Let's have a quick look on the MLA Content Map document. This is just for reassurance for all of you. So how is the MLA content map organized? The MLA content map is organized into 6 domains. What are these domains? Areas of clinical practice, and underneath the area, patient presentations and conditions. I'm going to talk about my course. All of these are covered in my course in all of the approaches, excluding counseling, ethics, and practical part. They are covered in this year, in these 2 areas. Okay? Clinical and professional capabilities, assess and manage risk or risk factors in counseling, safeguarding vulnerable patients under ethics, practical skills and procedures, like what? So examination cases and procedures. Procedures like what? Catheterization, cannulation, taking the blood culture for a patient. So these are covered in my course under ethics approach, counseling approach, and the practical course. All right? Areas of professional knowledge. This area is mainly for PLAB 1 part. Okay, the biochemical sciences. Medical and ethics, we can add them to PLAB 2. All right? So the 6 areas are for PLAB 1 and PLAB 2. All right? Okay, let's have a quick look on what is going on. Areas of clinical practice. You will find the topics. Okay? If you just click, let's click on what? Medicine of older people. You will find that all of the cases are covered. You know all of these topics or cases. They are ordered based on the alphabetical order. And if you just have a look quickly, all of these topics are covered in PLAB 2. So no need to panic, no need to be anxious. Just study what you study, practice on what you practice on, and, keep going. All right, doctors? Okay. Let's move up a little bit. Yeah, okay. So we have talked about what? The areas of clinical practice. Okay? Just click on the topic. You will find the topics or the name of the topics under this main topic ordered by the alphabetical order. All right.
Hello, hi, doctor. Just have a question. Where will we find these topics?
Again, please.
Where will we find all these topics to click them and find the
Okay.
details?
Can I answer your question after we finish, doctor, if you don't
Yeah,
mind?
sure. Why not? Thank
Okay.
you.
Thank you so much. Thank you. All right. Areas of professional knowledge, which I told you that it is mainly for PLAB 1. We can take from them the medical ethics and some of the genetic cases. You might find in PLAB 2 a patient who is coming concerned about a genetic disease which runs in his family. All right. Clinical and professional capabilities. It's very important to read some of them as a kind of reassurance for you. All right. Okay, what are the abilities that you need to have? You have to obtain relevant information about the patient through appropriate history and physical, mental health examination, formulating a prioritized list of problems and differential diagnoses. These are very important skills, and I teach them and emphasize on them in my course in each single case. Okay? Since I started. I started the course maybe 2 years ago, 2.5, something like this. all right? Assess and generates management plans for chronic conditions. You have to have this ability. Assess and generates management plan in emergency and acute presentations in SIMMAN, all right, or any acute case, all right? What else? Let's read quickly. Assess and generate management plan to promote health and prevent diseases. If a patient is coming to you asking an advice because he is traveling to a specific place, how are you going to give him an advice about this travel? What prophylaxis that you need to give? All right. What else? Yeah, communicates effectively with healthcare professionals, patients, relatives, carers, and other advocates. Demonstrates the understanding of the importance of self-care and personal well-being, manage pain, perform procedures safely, prescribes, reviews, communicate, and monitor the effect of medicine safely and effectively in prescription cases, safeguard vulnerable patients, like in the cases of what if you have a patient, a minor girl is coming to you and asking for emergency pill, you have to find, is this girl vulnerable or not? Does she have mental capacity or not? Is there a relationship with a position of trust or not? All of these aspects you should know and practice on them. And I emphasize on all of these in my course. All of that, all of that. All right? And I'm sure that all of the mentors are doing this. I'm sure that they are doing this in their courses. All right? So no significant change. Practical skills and procedures. We have talked about these. All right? The examination cases, SIMMAN, procedure. All right? These are the content or the MLA content map. Okay? All right. Let's then, yeah. I need to tell you that CPSA or PLAB 2, Clinical and Professional Skills Assessment, you as a candidate should be assessed on being what? On being safe doctor, on your ability of dealing with uncertainty of uncertain cases or uncertain diagnoses, your ability to be patient-centered or person-centered, all right? These themes should be explained thoroughly by all of the mentors. Me, myself, I teach them comprehensively in my course, all right? Okay, let's have a look quickly on the website, the GMC website, as a kind of extra reassurance for you. Yeah. How will the introduction of the MLA Content Map affect candidates? Read with me, please. The MLA Content Map sets out the core knowledge, skills, and behaviors needed for UK practice. All right? And this is what you know in PLAB, either PLAB 1 or PLAB 2. Can you see? Because PLAB Part 1 and Part 2 are already designed to test these areas. The standard of the test and the types of questions and stations currently used won't change. Won't change. Candidates' experience on the test day will also remain the same. Will also remain the same. Okay? The introduction of the content map should not impact any preparation that candidates have already done for the test. However, if you've used the PLAB blueprint to help you prepare, you just need to use or refer to MLA Content Map instead. This is the only thing that you can do. All right? Let's come back to our presentation. Okay. So, Dr. Sahar, you have talked a lot. You have explained many things. I appreciate that. All right? But I need to ask you this question, please, Dr. Sahar. Will this affect my preparation? I need to be reassured. Will this affect my preparation at all, Dr. Sahar? All right. No, this will not affect your preparation at all. The addition of stations, the deletion of topics, the changing on the names has been done since 2021. As far as I remember, March 2021. Let me double check with you. The content map. Yeah, can you see? Yeah. Can you see this? Can you see this, doctor?
Yes,
Yes, we can.
Changes applied from March 2021 on either PLAB 1 or PLAB 2. So the addition is in either PLAB 1 or PLAB 2. All right? So no need to be worried, please, please, please. Okay? All right. The other question is, will this cause any change for the eligibility criteria for the exam? No. No, doctors. Please keep going. All right? All right. Will there be any further change that affect candidates? While we don't expect to make any further changes at this stage, we will keep candidates up to date with the latest information about PLAB and the MLA. However, please be reassured that our current work to make PLAB compliant with the MLA requirements affects whom? The exam administrators, not the candidates. So it's about something related to the logistics. You as a candidate will not be affected at all. The eligibility criteria will be the same. All right? Will the PLAB test be renamed? The PLAB test will keep its current name because it can meet the MLA requirements without changing it. However, we plan to modernize the name of the test at later date. Okay? All right, doctors? All right. A take-home message. A take-home message. The exam format is the same. You will be examined in 2 circuits. You will have 16 stations as usual. You will have 1.5 minutes for preparation before each case. You will do the station within 8 minutes, or you will do the station for 8 minutes. The same exam format. The assessment will be the same. We have discussed that. Did you find any change of anything? No, it's just subtle changes like renaming of things, organization of things, addition of some topics in PLAB 1 or PLAB 2. And it has been done. It has been done. All right? Okay. If you have a new case in your exam, you should be able to deal with it. Okay? I teach in my course, my candidates or my colleagues, teach them how to deal with uncertainties or how to deal with any new case. If you have any new case in your exam, you will have 1 or maximum 2 in your exam, either in PLAB 1 or PLAB 2. one or two questions in PLAB 1 or one or two cases in PLAB 2. And you should be able to deal with it. If you have a new case, you just need to explore the patient's symptom, ask about the past medical history, touch on the psychosocial part. How has he been or she been affected by this problem? And then give differentials. You don't need to tell the patient you have this. You have to be able to deal with uncertain cases. If you are in the real life and one of the patients comes to you with a presentation or with a kind of concern that you don't know anything about it, are you going to tell the patient, I don't know? No, you have to deal with it professionally. Professionally. You gather some data about this concern or about this symptom, and then you explain your thoughts to the patient, what you are thinking about. And if you don't have an answer for a specific thing or a specific concern, you tell him, all right, to be honest, I am unsure about this specific point. Let me double check and get back to you. Confidently. Confidently. You have to show that you can deal with any uncertain case. And you have to show the patient that you are trustable. He can trust you in the future. All right? If you don't show that to the examiner or to the patient, you can't you can't pass this station. All right? And this is what I emphasize on during my course. So if you have any new thing, any new case, don't panic. It's just one or maximum two. And it will be on all of you, not only you, all of the candidates. All right? So please don't panic. Don't panic. All right. The examination body itself is telling you, be reassured. Why you want? You must trust the GMC. All right? The introduction of MLA should not affect you or make you panic at all. This change is because the reasons that I mentioned. They are going to assess you as an international graduate and the UK students based on a specific criteria. Okay, that's why they have introduced this or implemented this change. If someone should panic, they should be the UK graduates, to be honest. This is a totally new system for them, a totally new exam in their curriculum. But you, as an international graduate, you know what is PLAB, you know what are the principles, you know the common topics and common cases, you know how to prepare for this exam. But the UK students don't know this. All right? So please, please, please be reassured that everything is the same. Everything is the same. And any change has been already implemented since 2021. All right? Thank you so much, doctors, for listening. And thank you for attending. Hopefully you now know what is PLAB, what is MLA, and why is that happening, and what is the situation exactly. All right? Let's take your questions.
Doctor, I have a question.
Yeah?
Okay, so I'm starting PLAB 1, not PLAB 2.
Okay.
I've recently graduated. So I have a question. Right now, like before I knew about all of these not so different changes, I was planning to study from Plabbable and GEMS. Should I change my resources?
Okay, this is a very good question. This is a very good question. All right. So you started to prepare, all right, and you decided to take a specific path or, you know, a specific course to help you, all right? This change or what is happening now should not change anything in your preparation, should not change anything. I'm sure that Blabbable, I'm sure that any Blab 1 provider will deal with these changes, will update their courses, will update their materials based on these changes. Okay, and as I mentioned, as I explained, the changes has been already implemented. So that all of the courses and all of the providers should, you know, should have done these changes in their courses. Okay, so keep going and do what you do.
Okay, thank you very much.
Thanks, darling.
Hello, doctor. Can I
Oh,
ask you the question?
of course.
I have two questions. First is like I'm going to have my second attempt. I missed my success by just 2 marks, completed all the section and everything.
Sorry,
However,
sorry to
I
interrupt
have
you, darling. Sorry to interrupt you. Can you
yeah,
speak up a little bit because I have a difficulty to hear you.
okay. So my question is that I attempted in January, so I missed by 2 marks, the PLAB 2. So I have rebooked it on in the month of May, and I'm going to get the course from you. And what I was, my question was that, uh, I mean, like I'm a bit upset about this MLA. So I was just thinking if I could change it in the month of April, or should I mean, what do you think? I mean, uh,
All right.
I'm just getting a bit upset about this MLA. You have explained everything, but still it's making me a bit anxious. So what do you suggest?
Okay, darling. Okay. First of all, I'm really sorry that to hear that you didn't manage to pass the first time. Hopefully, inshallah, the next time you do it with very high marks, inshallah.
Inshallah.
Um, in terms of your concern, so you set up your exam in May.
In the month of May, yeah, 24th of May, yeah,
Which day in May?
24th.
24th of May, and you are
Mm-hmm.
thinking to take the exam earlier than this.
Yeah, I mean, I have got like just if I take it in April, I will have so like 1.5 months. So I'm taking course from you as well, but I don't know. Would it be a good idea or should I take a proper preparation? Because
Okay,
I'm a bit anxious about this MLA. I mean,
okay, darling. So I understand that you should be anxious about the messages and changes, but we have explained everything. Don't worry,
yes.
the changes will not
Mhm.
affect you at all. The changes will not
Okay.
affect you at all. And if there is any kind of update or any kind
Mm-hmm.
that might affect
Mm-hmm.
you in your exam, it will be
Mm-hmm.
updated in the course. All right?
Okay. Yeah.
Okay. I
Yeah. Sure.
always prefer to go to your exam well prepared
Right.
instead of going under prepared.
Right. Mm-hmm.
Okay. If you
Yeah.
go to the exam well prepared, you will be able to deal with any case, with
Right.
anything, even if you don't know anything about a case, you will deal with it.
Mm-hmm.
All right, if you
Right.
are well prepared. This happened with many candidates in my course.
Right.
Okay,
Mm-hmm.
they had new cases, they didn't know anything about them, and they passed with cases with high
Okay.
marks. Wallahi,
Right.
with high marks. I'm not telling you that just for reassuring you.
Mm-hmm.
This happened. Okay?
Okay. Okay.
So
Thank you, doctor.
don't panic at all. Don't panic at all.
Mm-hmm.
Go to your
Mm-hmm.
exam well prepared, and
Right.
don't think about any changes or anything, or don't listen to others. Some people
Right.
wants people to just to panic without any reason. This is their
Right.
personality. Okay,
Yeah.
so
Yeah.
just focus on your practicing, just focus on your preparation, and that's it.
Right. Right. Thank you, doctor.
Okay,
And the
darling.
contents, doctor, where can I find these contents which you clicked on?
The content
The
of the,
contents.
yeah,
Yes.
all right. So these contents are from a document. I can share this document with you in the Telegram group, but
Thank you.
just be minded that the content are not for PLAB 2 only.
Right.
It's for PLAB
Okay.
1 and PLAB 2. All right.
Okay. Okay.
So
Right. Right.
so what you need to focus on is the curriculum or the index of my course.
Okay. Okay,
Right.
doctor. Thank you so
Okay.
much for answering my question.
Thanks,
Thank
darling.
you.
Thanks. Yeah. All right. Dr. Salah is raising his hand.
Yes. Dr. Sahar, thank you so much for this presentation. I have two questions.
Yeah.
The first questions, as the two exams are unified and we are entering the same exam as the UK students, do you think that this will affect our performance as we are competing against the national students? This is the first question. This is, I'm a little bit afraid of. The second question is regarding your course. How much is the adequate time and how much does it cost? And the last question, I'm sorry, is it
It's fine.
available online or not?
Okay, so you have three questions just to answer all of them. The first one is, will this affect your performance? Or
Yes,
the,
as we are competing against the national students, does
okay,
this will affect the results of the average
course.
passing grade?
Okay, the passing grade. All right, what else? The other thing is the course.
Regarding the course, how much
Okay.
is the adequate time to prepare for a PLAB 2, I mean, and
Okay,
the cost, and is it available online or not?
okay, all right. So the first question, it's a really good question, to be honest. And the answer is no. It will not affect the results. You will be assessed by the GMC. You will go to the GMC buildings. You will have the exam there. They will assess you. And the UK graduates will be assessed in their universities in a different place under the under the umbrella of the GMC, but in their place. This will not affect the results at all. The results of each, or the passing score of each day, is based on the general performance of the candidates which are in this day. Got this?
Sorry, is it objective assessment rather than a curve to be applied for all the students?
Okay, so the pass in PLAB 2 is based on a general score in each day. All right. When you go to the exam, you will have some candidates with you. All right. The pass in this day, the pass rate in this day will be based on the general performance of the candidates in this day. All right. If the general performance is very high in all of the cases, so the passing score will be very high in this particular day.
I understand now. So are we competing against the IMGs
Yeah,
in the same day? I
the
got you,
same
Dr.
day
Sahar.
with the
Yeah,
same
yeah.
day. All right.
All right, yeah.
Okay. This is for your first question.
Okay.
For your second question, the course and the content and everything. Okay, the ideal time to prepare for PLAB 2, you have to have at least 3 months for preparation, and extra month for refurbishing your technique. So in total, 4 months. Okay. If it's more than 4 months, will be very good. All right. And if someone is talking to me privately and he wants to take the course and his exam is in 2 months, I tell him, I'm really sorry, I can't let you subscribe in my course. All right. So
Yeah.
minimum 3 months and extra months for revision and refurbishing everything. All right.
Yeah.
The course is online, and I can share with you all of the posters of the course and the content. And if you have any extra question for you, you can send me privately, and I'm going to answer all of your concerns, inshallah. All right.
All
Any
right.
other question?
Thank you, Dr. Sahar. Thank you so much.
Thank you. All right. Any other question? What we should use as source for PLAB 2? Okay, well, it's based on your preference, Dr. Redemi. It's based on your preference. There are many courses and sources to prepare from. If you are going to take a course, you have to find out the free materials for this course. Just let me mute the candidates. You have to find out the free materials for each course provider, and then you decide by yourself which is the best thing for you. Okay. In terms of the sources, if you are searching for free material to practice or to study from, I hear very good feedback from all days notes. Okay, so you can start preparation from them if you are searching for something free, but the management should be from the CKS website or the NICE guidelines website. And I've talked thoroughly and comprehensively on the preparation in the introduction video in my YouTube channel. I will share with you again the YouTube channel so you can watch the video of the preparation or the introduction of PLAB 2 and how to prepare. So you can watch this video. It will be really helpful for you.
Excuse me, Dr. Sahar.
Yeah.
I have one last question regarding the practical part. If someone takes the course online and wants to have some hands-on practice or training, how could we arrange this if someone is outside the UK?
Well,
what do you suggest in this regard?
All right. Okay. If you are outside the UK, are you in Egypt or in another place?
I'm another place. I am actually from Libya.
All right. Okay. So I think if you want to have some hands-on in any academy can help you. All right. But if you are going to take my course, the practical part is more than enough for you to have an idea about all of the practical cases. What you need to do is only practicing on pillows or dolls at home. This is what you need to do. If you're in Libya, you can just buy cannula catheterization kits from any medical stores. You can buy these things and practice on them at home or in your hospital. Do you work in a hospital or what is your grade?
Yes, I am practicing medicine. Yes.
Okay, good. Okay, so well, you don't need to panic or you don't need to do anything with regards to the examination part or the procedure, as long as you have this background and you do this every day in your hospital. All right?
No, but Dr. Sahar, as a doctor, it's been time that I've put a cannula or put a catheter. This is usually a nursing part, so I'm
All
not.
right.
You
Okay.
understand me?
So what I could advise you is just buy the kits from any medical store in your country and practice on them at home or in your hospital. You can ask to, you know, to do catheterization or cannulation in your hospital if it's applicable. Many candidates with me passed without taking any academies, but this is based on your preference, to be honest. If you are that one who is panicking and you are going to panic once you see the mannequin in front of you, or you will panic when you see the simman the first time in your exam, so you will have to have some hands-on in any academy. Any academy should be ideal for you with
Mhm.
my course. Okay, you
Mhm.
just need like 3 or 5 days to hands-on. That's
Mhm.
it.
Yeah. This is very reassuring. Thank you so much, Dr. Sahar.
Thank you. Thank you so much, Dr. Salah. All right. So yeah, okay. So I think I have answered all of your questions. Just be reassured, doctors. Nothing is changing. Nothing is new. There is nothing called new case or new topic or new something. It's just about, you know, in what is happening is just renaming or a kind of implementation of a system for the UK students, not for you. All right? And the changes will affect the examiners, not you. Not you. All right? Be reassured, prepare well, keep going, and that's it. Don't let anybody to make you anxious. Don't let anybody to make you panic. Just ignore the messages that will make you anxious and go with the messages that will reassure you. This is what you want if you are going to take your exam soon. This is what you want now. You want some reassurance. You want some reassurance. And this is from the GMC. I didn't say anything from my mind. I have read with you all of the points from the GMC website and from the documents from the GMC itself. All right? So please be reassured. All right? Okay. Thank you for attending. Bye-bye.